Hi everyone, this is Annindita Palaus, and today's video is on a very frequently asked question which a lot of my women students have often asked, and that is about Reiki and pregnancy. So is Reiki safe to be done during pregnancy? And Reiki is actually a very simple healing modality, and it is completely safe to be done before childbirth, during childbirth, or even after childbirth. And there are no specific do's and don'ts for Reiki during pregnancy. The only thing that I would suggest to keep in mind is just make sure that your client is absolutely comfortable. And they don't necessarily have to be laying on the massage table. In fact, they could be sitting as well, because depending on the stage of pregnancy that they are in, it might be uncomfortable for them to be laying on their backs. And they don't have to be laying on their backs. They could be laying sideways if they want to, or they could be just sitting in a reclining position if you have a reclining chair, or just sitting in a regular chair, and it could be done like that as well. It could be, of course, also done distantly, especially during these days with COVID. A lot of women might feel uncomfortable going in person, so it can be always done distantly as well, which is 100% safe. Now, I have seen discussions in certain Reiki forums and communities about if there are any specific times during the trimesters when Reiki should or should not be done. And while most Reiki practitioners believe that it is 100% safe and it can be done throughout the period of a woman's pregnancy, however, there are certain concerns, and I would say these are valid concerns raised by some practitioners, which is why they suggest to not do it during the first trimester. And the reason being that the first trimester is actually a very sensitive time. That is the time when most of the miscarriages tend to happen. So just in case, the miscarriage would never happen because of Reiki, but just in case, if a miscarriage does happen after a client has been having regular sessions with you because of some kind of complications that their pregnancy might have had, there is a slight chance that they might end up blaming you for that. And just to avoid that, if you feel that it is better to just not work with women in their first trimesters, you could choose to make that decision. And another thing that I would suggest is that if you are doing Reiki in person as a business, not just for a friend or family and relatives, then for sure have your liability forms ready, prepared by a proper lawyer, and just be aware of the laws in your state. Especially here in the US, the laws vary from state to state. Also make sure that you have business insurance, and as long as you are careful about the business aspects of it, having insurance in place, having your liability forms in place, and making sure that your clients are signing those forms, is basically a release of liability form. And you are probably pretty well aware of these forms anyways. When people go for, let's say, something like hot air balloon ride, or even something like a river rafting ride, they literally make you sign this huge disclaimer where they say that anything can happen to you during the ride and they would not be held responsible. So just something along those lines, any attorney would be able to prepare that for you. So as long as you have your bases covered, there is nothing to be really worried of. Personally speaking, I myself wouldn't mind doing Reiki on a pregnant woman no matter which trimester she is in. However, because I came across this certain thread of communication on several Reiki forums where people tend to have different opinions about this topic, I feel like I should mention that in this video. So this is something that is totally your call, and you need to decide for yourself. If this is something that you feel that you should or should not be doing during the first trimester, then just make that call and let your clients know that once they are in their second trimester or later on, you are willing to work with them. But in the first trimester, just to be on the safe side, you choose not to. And again, that's not because Reiki will cause any harm, but you have no control as to how, the person or the mother who had a miscarriage, she's going to be very emotional. And when a person's emotions are running high, often they are not able to think things practically or logically. And somebody might have a tendency to blame you if they don't understand properly how Reiki really works. So just to be on the safe side, if you feel like you should not work with women in the first trimester, then is totally your call. Just be guided by your intuition. And Reiki can also be very helpful postpartum for dealing with postpartum depression, mood swings, hormonal imbalance. It could also be very healing for the mom and the baby both, especially if the mom went through a lengthy or traumatic birthing experience. It can also help improving breastfeeding and milk production. It could help in calming down the baby as well as in releasing anxiety in the mother as well. And both the baby and the mom can be receiving the Reiki at the same time. And sometimes they might even just fall asleep into a deep sleep during the Reiki session. In fact, Reiki can also be done during childbirth. And in that case, of course, the Reiki practitioner will not be in the room, but they could be doing it distantly. Somebody can let the practitioner know in advance so that you have your times matched. But another thing that I do say is that even if the practitioner does not do it exactly at the same time when the childbirth is actually happening, that's still fine, because Reiki can be done in the present. It can be also done on past experiences, and it can also be done for future experiences. So let's say your Reiki practitioner is not available for that specific time of the day when you will have your delivery. You could always have the Reiki practitioner do the healing session in advance with the intention of you receiving it when it is needed, because time and distance does not work linearly with energy healing modalities such as Reiki. In fact, there was a very interesting clinical study done by the Hartford Hospital in Connecticut on the effects of Reiki during pregnancy. And in these clinical tests, they found that just the very simplest form of Reiki helped in reducing stress and anxiety by 94%, helped in reducing pain by 78%, and nausea and morning sickness by about 80%. They also noticed that the sleep quality of the pregnant moms improved by 86%. So that definitely proves the point that Reiki is extremely safe for women during or after pregnancy. And it will definitely help in reducing a lot of the pain and discomfort that women go through during pregnancy. So I hope you liked this video. If you liked it, then like it, share it with someone who would find this helpful, and don't forget to subscribe to my channel. I will talk to you soon. Bye for now.